Wanted to welcome our next guests here in studio this morning from the Grande Ronde Hospital. From the Financial Services Department, we have Teresa here in studio with us. Thank you, Teresa, for stopping in this morning.
Thank you for having me.
And also we have Mardi here from the Grande Ronde Hospital. Thank you, Mardi.
Good morning, Cliff. Thank you.
Well, great to have you ladies here in studio this morning to talk about, well, a very important aspect when it comes to health care and medical services that are received here through the Grande Ronde Hospital. And that is the financial aspect of things. And Teresa, I know that you work constantly in financial matters here with the Grande Ronde Hospital. Do you want to talk a little bit about what you do and what type of overall services you provide and guidance you help people with?
Sure. Grande Ronde Hospital has a financial counselor team. There are 5 of us. We are patient advocates. We are here to help patients navigate the financial side of their health care.
Okay.
We help with their billing, setting up payment plans. We have a financial assistance program we help them apply for. All financial counselors are certified through the state of Oregon to help individuals apply for the Oregon Health Plan. At Grande Ronde Hospital, we have a special program through the state. It's called the Hospital Presumptive Eligibility. We can actually find patients temporarily eligible for the Oregon Health Plan when they don't have time to complete a full application, but they need prescriptions or medical treatment right away. We can find them temporarily eligible. We do service estimates also for patients that are having upcoming procedures. That way they know what their out-of-pocket costs are going to be.
Well, and that's one of the things that I think will make the process go a whole lot smoother is the answering of questions or kind of dispelling any myths that you may have about the financial aspect of a procedure or even a doctor's visit. Many people may be fearful of what that answer may be and therefore put it off.
Exactly. So we do have patients can stop by our offices or they can give us a call and we will go through all aspects, checking with their insurance to make sure Grande Ronde Hospital is in network or the provider that they're seeing is in network. We'll explain the charges that are going to be incurred with that visit or with that procedure and what their out-of-pocket costs are going to be.
Now, Mardi, the Grande Ronde Hospital is a not-for-profit organization here. I mean, it's important for patients to understand the financial aspect before procedures, but even after procedures too, so that they have a much clearer understanding. And I think it's the financial counselors that do a great job in being able to convey that with patients.
This is absolutely true, Cliff. It was something that several years ago we discovered that a lot of people in the community, even though Grande Ronde Hospital's been here since 1907, they didn't really understand that we were a not-for-profit, exactly what a not-for-profit is, that we have such a generous financial services program. And so several years ago, Teresa, I don't remember exactly what it was, we decided to really bring it to the forefront. And Teresa was the very first one. She has a great little office right there in the lobby of the hospital, and she really built this program, and now there's 5 of you that do this in several different locations. So it's an extremely important part of what we do, and Teresa brings a great deal of passion for it. She considers herself to definitely be a patient advocate, and she was just talking this morning about one of the things she loves the most. That was a cute story. Talk about they come in and see you when they've had their babies and stuff. I love that.
Yeah, so there's been a few individuals that have come in really worried about how they were going to pay for their health care when they were pregnant, not knowing that pregnant women qualify for the Oregon Health Plan at a much higher level financially. So I've helped them get on the Oregon Health Plan to cover their cost of their pregnancy. And it's always nice when they pop back in afterwards to show me the end result. And here's my baby, And
the smiling end result.
Exactly, because it takes that burden and that worrisome away, and then they can enjoy their pregnancy. They have that baby, they come back, they show you, this is my end result. And it's just really nice.
Oh, wow.
Yeah.
Now, when it comes to health insurance, I mean, if you ask just a random person off the street, what exactly does your health insurance cover? I don't know if anyone would be able to tell you fully in what it entails, but that's where financial counselors are able to help guide you through. And whether, whatever type of health insurance you have, and you're looking to take part in a procedure or medical checkups or other routine medical needs, you can work with people to figure out exactly what the insurance is going to cover, even if you, the insurance holder, doesn't necessarily know yourself.
Exactly. And we can explain to them what a deductible is, what a coinsurance is, what co-payments are, what their out-of-pocket maximum means. A lot of people do not know. They know that they're covered. They don't know what their deductible is, and they know that their coverage started on this date, and that's about it.
Yeah.
So we help them navigate their health insurance process. And then we also work with local agents in town. So if there's something that we're not understanding, those local agents can help us understand it also.
Oh, okay.
Or can help them. If they're not eligible for the Oregon Health Plan and they need to apply through the Affordable Care Act, we do work with local agents in town that help them do that. We help them navigate, explain the Affordable Care Act and things like that to them, but we hook them up with local agents that can really find the best plan for this area.
Oh, yeah. Well, health insurance is one of those things, Marty, that when you're trying to go at it on your own, you may or may not fare very well. So it's good to be able to have experts that you can rely on to help navigate through that.
Yeah, absolutely. I have been a client of Teresa's, and she is awesome in helping you. So I would suggest that anybody who has any questions about what we do for them, to give Teresa a call and let her walk them through what that process is going to be and what it's going to look like for them, because she's really good and she's patient. She's very patient.
Well, so I guess on the flip side then, what about the lack of health insurance? I mean, you mentioned how finding maybe a temporary insurance plan or something for an upcoming procedure. Can you still work with people as far as what to determine that financial amount will be when it comes to a certain procedure, or you're looking for a very specific medical service here? Can you still work with people even if they don't have insurance? Maybe they're waiting for something to kick in, or in between jobs, or whatever other circumstance it comes up?
Yes. So when somebody's having a procedure, and with Grande Ronde Hospital, we help patients regardless of their ability to pay, whether they have insurance or not. We have a financial assistance program, and it's very generous. It goes all the way up to 500% of the federal poverty level. So that is very generous. Most hospitals that do have financial assistance programs, they cap theirs at 300%.
Oh, wow.
So ours, you can get all the way up to 500% of the federal poverty level and receive some sort of an adjustment of a percentage off, as long as you qualify financially. And then, so when somebody comes in and they don't have health coverage and they need medical treatment, we make sure that they either apply for the Oregon Health Plan to see if they qualify for that, our financial assistance program, or we set them up with payment plans.
Okay.
And those that are uninsured, they get a percentage, a self-pay discount off of their billings with Grande Ronde Hospital. So that does alleviate some portion of their billing, and then it also helps them kind of on an even playing field with those who do have insurance. So, yeah.
Well, yes, and certainly looking at that before, but even after the medical procedure. I mean, if circumstances change or follow-up appointments are necessary, can you still work with people to make those financial adjustments and see what their particular situation calls for?
Yeah, and we can help them all the way up till the end of the billing period.
Oh, okay.
So our billing period goes for 240 days. If they... Within that period of time, we have reached out to them several times with our financial assistance program, contact information for financial counselors. So as long as their billings are still in-house, we can still help them.
Oh, wow.
Yeah.
Okay.
So they can apply for financial assistance at any time during their balance is open with Grande Ronde Hospital.
Okay, well, that's good to know, because then it may not be a situation to where you feel as though you're stuck. You can't go back in time and fix it. There's still some flexibility here for financial assistance.
Yeah.
Well, now we're joined this morning by Marty and Teresa from the Grande Ronde Hospital. And Teresa, one of the 5 financial counselors with the Grande Ronde Hospital. Now, you mentioned, or Marty had mentioned, that you're kind of spread around as far as locations go. Where are the financial counselors located? How can people contact them? Okay,
so we have Dina. She is at our specialty clinic, the Regional Medical Plaza. She's in the Women and Children's area. We have Kim. She's at the Regional Medical Clinic down on 4th Street. We have myself. I'm in the main lobby of the hospital. And then we have Mariah and Susan. They're down at our business office at the Pavilion down on Adams, next to the library.
Okay. And if anyone has any questions at all when it comes to financial matters or whether they're in need of a surgery or checkup or some type of medical procedure here coming up, or not, if they have general financial questions through the Grande Ronde Hospital, they can just contact you anytime during business hours to inquire upon their particular financial needs?
Yep, and they don't even have to be a patient of Grande Ronde Hospital. We can help them with the Oregon Health Plan, just the general public.
Oh, okay.
If they want to come in and apply for the Oregon Health Plan or that temporary assistance through the Oregon Health Plan. They don't have to necessarily be having services at Grande Ronde Hospital, and we can still help them.
Okay. Well, good to know. And if anyone wanted to contact a financial counselor directly, maybe by phone, if they're listening and maybe outside of the La Grande area, how can they contact you? Who should they call?
So we have a direct financial counselor team line, and it rolls to all 5 of us. The number's 541-963-2845.
Okay. All right. So 963-2845. If you have any questions at all, contact a financial counselor with the Grande Ronde Hospital, and they'll be happy to answer any questions you have. And Marty, this is such a great opportunity for people to be able to ask, not only before, during, after medical procedures. I mean, because the financial aspect of health care nowadays, not getting any easier to go at this alone.
No, and Teresa likes to say that they're there so that people don't have to worry about the money, and that they just need to worry about getting well and getting back into the quality of the life that they had. So I think if people have just any general questions or they're not really sure, they want more info, they're not comfortable about calling yet, please go to the hospital's website, grh.org. There is a huge amount of information under the patient and visitors tab about our patient financial program and all the things that Teresa do, as well as all the contact information to get a hold of Teresa and the rest of her team. So
yes, very good resource too, the Grande Ronde Hospital's website, grh.org. Well, Teresa, Marty, thank you so much for stopping in this morning. Really appreciate it.
thank you,
Thank
Cliff.
you.
Thank you.